I see the BOSS catheter one of the unique catheters that adds significant values for operators that are dealing with more complex anatomy. And I believe the majority of physicians in the US today are dealing with that. Occasionally you'd have a high-grade stenosis, 99%, and if it's located in the harness canal, for instance, in the popliteal, you can have a significant amount of calcification that does not allow a catheter to just fly through. On top of that, it could be completely occluded, either way. So when you use a BOSS catheter here, 035, you take it down and use whichever wire you decide to use with it. One of the things the BOSS catheter can do is whatever kinetic energy you generate with your left hand as you rotate it, you grab it with the second hand and you just rotate it additionally and you augment that kinetic energy at the tip. Then your wire have more support and more trackability. And as you rotate the catheter back and forth, the wire actually allows the catheter to propel itself forward over it. So basically you're creating a sort of daughter technique, doctor-daughter's technique, which is you're creating a lumen out of no lumen. And this is why this catheter would be significantly important for physicians that are entrenched in complex anatomy, especially long calcified CTOs and popliteal. One more thing about this revolutionary combined catheters, the 035 and the 018, coming from above and from below. So once you cross, and sometimes there's certain segment of the CTOs that you can only cross from below, retrograde, and part of it you can only cross from above, antegrade. And finally, both catheters meet each other, in the middle. The next step is to advance your wire from one catheter into the other one. So you go from the retrograde catheter wire, advance it into the antegrade 035 catheter. Once the wire is in there, this catheter will you rotate it, advance it, and it will fly into the catheter. That is one of the most unique things about this combined 018, 035 BOSS catheters, because the tips of both catheters are robust, do not actually get any kinking in them, they don't flare. So once actually the wire is in, the catheter will just fly right into the 018 flies into the 035. And that's going to be the most satisfying part of your procedure as you do an actually complex long CTOs, because you already achieved the ultimate goal. You just treated another patient that was very complex to be treated otherwise. So hopefully you experience this euphoria that we do when we use these combined catheters.